leveraging every bit of city infrastructure to keep ensuring that everyone is safe as we're headed into winter weather.
Mayor, Mayor Janey earlier was telling us that the numbers are looking pretty good. We're at 2.1% stable, almost 73% of the population of Boston is first shot. What numbers would you look at after talking to Marty Martinez to start losing the vaccine and start loosening it permanently?
Yeah, we discussed earlier today with the mayor's office as well as with the Boston Public Health Commission that we need clear metrics to help drive our decision making. So they'll get back to me with some more information there. It's also important to continue to understand where the gaps and disparities are. Our rates in terms of overall vaccinations are very high across the state relative to other places in the country, but when you break it down by neighborhood, by race, we continue to see disparities that the city needs to work hard on those.
Matt, do you mind giving a specific strategy to try to get more people vaccinated in the future?
Using every bit of our city organization to help push for young people whose families are willing and ready for them to be vaccinated would be a huge step. The new authorization means that a whole new group of Bostonians is eligible for vaccination, and so we'll start first with partnering with community clinics to provide the spaces and information about what is new and how this continues to be the safest way to protect every single person and their families and communities. And then eventually working through our school infrastructure where we see our young people every day to make this available for entire families.
Is it possible school nurses to do this? It would be kind of simple, wouldn't it?
Yeah, we have many partners across the community, whether it is community health centers or healthcare providers, and we'll look to ensure that we are working with every possible touch point into people's lives that we can be closing vaccination gaps and providing the information to build trust in the vaccine and demonstrate that this is the way that we keep everyone safe.
So what is the big takeaway from today's briefing?
The biggest takeaway is that we still have much work to do. We are in a very different place today compared to a year ago or a year and a half ago, thank goodness, but many of the systems that have been set up for us to be in close communication with hospital partners, with community partners, need to continue as we are seeing more residents eligible for the vaccine and a shift into colder weather, so more people will be indoors as well. The humanitarian crisis at Mass and Cass is truly an overlap of multiple crises: substance use, mental health, as well as housing. And so the key here is that we need to move as quickly as possible to connect residents seeking treatment with stable housing. There are open shelter beds, but many of these still come with barriers or residents don't feel fully safe or comfortable there. So we need to move into a situation where we're providing that medium-term, long-term housing so that everybody can have a safe roof over their head, a place to store their belongings, and the dignity and respect to seek treatment and have that stability. So I'll continue working with city agencies who are moving to ensure that we are providing a public health-led approach that is grounded in quickly producing as much low-threshold stable housing as possible.
Mayor, like with COVID, was there anything you learned in today's briefing that you just didn't know or just didn't see how much of a challenge that's going to be?
There's been incredible work that's happened over the last 18 months, and we are now in close communication with partners from various sectors. We do see now, though, that some of the infrastructure that the state has stood up for contact tracing, for example, is now being wound down, and the city's going to have to step up to continue to fill some of those gaps. We will keep contact tracing efforts going, especially when it comes to schools and to young people who are not yet fully vaccinated. And so we're needing to move a little bit to accommodate the changes happening in other places around the city and Commonwealth, but this is a set of experts and dedicated public servants who have been at this for a while, and we have our systems built. We just need to continue moving ahead.
No protocols changing until you start getting more information.
About masks, you mean?
Masks or just any protocols that are in place right now.
Yeah, the city is tracking the data very closely, and as we are transitioning into the role working alongside Mayor Janey and her administration, I am starting to be in more and more of these meetings, so I'll continue to be briefed, and by the time we are making the official transition, there should be more information.
Did you discuss school violence at all, and do you have a different take on how to solve the problem?
Yeah, I have spoken in the last few days with school officials, with the superintendent, and with our public safety officials as well. Every single child and every single educator and part of our community needs to feel safe in our school classrooms. That means more supports and staffing. That means services provided to our young people and a focus on how we continue to wrap all the resources we have around our children and their families. One of the first actions that we will take will be to set up our children's cabinet to really provide those supports so that it's not all on the shoulders of Boston Public Schools, and pull in the resources we have around housing stability, around language access and food access, so that we're really providing the whole picture.
It's more than just trauma intervention or security.
Our schools should be a platform for young people and their families to access any number of services and opportunities that are available. So, of course, we need to be very intentional about responding to specific incidents and ensuring that these incidents do not happen. But the big picture is we have a lot to offer our young people, and Boston Schools needs to be the hub and the platform to connect everyone.
On that subject, have you spoken with the principal?
I've reached out to family members and multiple folks in the school, and so we'll continue to be in touch and ensure that we are doing everything we can in response to this incident, which is horrific and very traumatic for the entire school community, as well as remember that this is a larger issue where we need to support all of our young people and provide the access to services across the whole school community. Thank you.